So while Josh is pulling up the slides, I can go ahead and start us off with a question. So if you can put it in the chat, that would be great. Let me just adjust my screen. There we go. So I'm going to be talking today about the window of tolerance and building up emotional regulation. So I want to start out though and ask the question, what does a student need to be ready to learn, to really function at their best? So let's take a couple of minutes or a second or so, or a few seconds or so, and just kind of see what responses we get. Don't all go at once.
Can you repeat that, Josie?
Yes, I can. And please let me know if you're having a hard time hearing me or anything. So what does a student need to feel ready to learn, to function at their best? Yeah, I see safety, safe culture and climate, a feeling of belonging, feeling supported, feeling as if they matter, food, shelter, breakfast, happy, meeting needs, feeling loved, recognized, physical and emotional safety. Yeah, absolutely. All of these, absolutely. And I want to ask the other question, is that any different for any of us? We all need these things, right? We all need that piece of understanding and safety and recognition and food and shelter and routines. Absolutely. All of those things signal to us safety and help us function at our best. And that's what we're going to talk about today. Is we're going to be talking about what do we need to stay in a zone that keeps us safe and helps us function most effectively, and what happens when those zones are disrupted and narrow because of trauma or stress. So let's go ahead and move forward to our first slide. Thanks, Josh. So I first want to describe just this picture, and this is kind of showing an image of a healthy nervous system. And what you see in there is kind of these waves, right? The ebbs and flows of emotions and what can happen. And you see those outer layers, and that's really describing something called our window of tolerance. And you may have heard this before. Absolutely, coping skills. So the window of tolerance describes the normal brain-body reaction to changes, to stress, to the ups and downs of emotions. And as we experience pain and sadness and anxiety and anger, those experiences bring us closer to those edges. Now, everyone's window of tolerance is different, right? Everyone's tolerance level is different based off of their experiences. But typically, we can manage to stay within that window in a state where we can cope, we can calm down when we're upset, we can problem solve, and we can stay in that safe place. And when we're in that safe place, we're able to self-soothe. However, over time, we get fatigued. When our situation hasn't improved, our abilities to tolerate is going to decrease. And our ability to cope can eventually become overwhelmed, and our window begins to shrink. So it begins to narrow. So we can take in less trauma, less stress, any of those things. It becomes harder for it to pass through, which means we eventually have a harder time dealing with those things. So we have less of a capacity to tolerate stress and change, and are more likely to become overwhelmed more quickly. So those small irritations can have a bigger impact. And I want you to think about this year. The constant shifting, the demands, the losses that we've all had to endure. All of that was happening rapidly, right? All of this was a very quick, rapidly occurring. The demand to adapt and to function at our best at all times. And what happens is that weighs on our body, and we're not set up for that without building up some of our resiliency or building up some of our defenses. So if you've noticed that you're more tired than usual, more irritable, feeling on edge, maybe that's an indicator to say that I need a break. I need to recharge. And that's okay to do that. I think about it like filling a glass of water. The closer and closer you get to the edge, the smaller the amount of water you need to really have that glass overflow. So when we're operating outside of our window, our prefrontal cortex, so that thinking part of our brain, is unable to operate. So think about our kids. If they're out of that area of their window, if they're not in that safe, calm zone, it's going to be very difficult for them to attend, to think, to function, to learn. they're going to be preoccupied by all of those other things for seeking safety. And we've talked about this before. I feel like this kind of encompasses a lot of what we've talked about throughout the year about anxiety and trauma and what that does to the body. So going back, when we're able to address those needs and really look at how can we, if someone is in a particular state, how can we address that? We're able to be more effective in bringing ourselves back into an area that feels safe. So what does this mean for our students? What does this mean for ourselves? Is that we all have our limits to what we can handle, to what we can tolerate. And when we are able to learn and to track those responses, we're able to respond to them and build up our resiliency and our capacity. So what I have here, the first state that I'm going to talk about is called hyperarousal, and that's our fight-flight state. You can see, I think the best way to describe it is like that volcano, that explosion, and that's really what we see. In this state, the person is really alert of their surroundings. So think about hypervigilance, so that constantly scanning for safety. What this can look like in our students, it could be a state that's more behavioral, so more external, meaning that it's typically something that you can see actually happening. So someone yelling and screaming and crying, kicking, all of those things, anxiety, overwhelmed, chaotic responses, outbursts, both emotionally and aggressively. And remember, at this point, it doesn't take much to set this person off or to put them over the edge, right? To overflow. Anger, aggression, rage, that rigidness, obsessive thoughts and behaviors, impulsivity. And I think the takeaway from that is that this isn't a choice. I think oftentimes we associate behavior with some of that is like choice behavior, right? What this is describing is that we are at a place where we no longer have control. We no longer have that way of responding and self-soothing. And so what's happening is that our body becomes out of control in that sense. And so that's what we see are these like really aggressive outwardly displays of what's going on inside of us. So in this state, your body wants to fight. It wants to run away. So our heart rate increases, our blood pressure increases, our breathing becomes more rapid, and our body is getting ready. This keeps our system stuck on. So that's another way to really think about this, is that it keeps us stuck in this kind of on alert state. And it makes it really difficult to relax, to concentrate, to sleep, to eat, to digest food, and to really manage our emotions. So in this state, we are more reactive. We're more likely to have that very startled response, difficulty concentrating and focusing, really feeling unsafe in any space. And again, that constantly scanning for threats. So thinking about this as a school and looking at our students, they've had so much to adapt to and to change to where, you know, that safe area that they could be, that area where they can be calm, that really got tested, right? So is this something that we've been seeing with our students, seeing them in that really hyper-vigilant state or that hyper-arousal state? And again, I want to point out that this isn't a choice behavior. This isn't something that they're choosing to do. At this point, it's that loss of control, that loss of functioning, and really trying to get back into a state where they feel safe. So what are some things that we can do to really address that? This list might look familiar because I talked about this before. I talked about some of these before when we looked at the mindfulness methods that you can use to incorporate into the classroom. So the last talk that I did, what I like about this list is that these are all things that we can, well, maybe not all of them, but these are things that we can incorporate into our day. So, you know, the deep breathing, this is something that I mentioned before that, you know, you can start out your morning or during transition periods, really focusing on deep breathing and teaching our kids how to do that belly breathing, or just playing calming music in the background. Or taking our kids outside to like stomp out energy. That's something that we can, you know, just incorporate as part of the day. Or, you know, any of the like heavy work, lifting, pushing up, those kind, or push-ups, those kinds of things. All of these things are something that again works to decrease that arousal state when a student is in that hyper-arousal state. Let's go ahead and take a look at hypoarousal. So the interesting thing about this would be, we went from being stuck in that on state, that constant go state. And this is when the body is shutting down. So at this state of hyperarousal, this might occur when we're in such a state of hyperarousal, where we're surpassing that pain and that emotionally overwhelmed feeling that our body can't tolerate it anymore. And we get to a place where we just plunge into a shutdown state. In this state, our system is stuck on exhaustion, depression, like no emotion, so flat affect, numbness, disconnection, and dissociation. I think that, taking a look back at this year, especially with mental health, I think about, early on in the pandemic, I feel like I saw more of those examples of that hyperarousal, that, overreaction, that aggression, that agitation. And I feel like as the year trickled down, some of that shutdown came in, where I'm seeing more of maybe that exhaustion. And I think even in simple senses, like I recall talking to a colleague and just kind of asking, how was your weekend? I didn't do anything, but I'm so exhausted. I'm so tired. It wasn't enough time, right? Where it doesn't really take much, but we still feel drained throughout the day. Again, this is the place where there's that disconnection, that not feeling like you're present, that shutdown, unavailable, memory loss, being stuck in autopilot, really feeling like a shell in a sense, right? Not being able to access those places that really make us feel like we're connected. Again, thinking about our students, thinking about ourselves, is this a place where you would say someone feels safe? Is this a place where you would say that someone's able to attend and take care of their needs and eat breakfast and do all of those things? No, right? This is a person who's disconnected. So how do we, again, look at this person, recognize that they're in a state where they're shutting down, and address that to help bring them back up? We can move forward to the next. Thank you. So again, looking at, here are some activities that we can do to help stimulate those, that increasing that arousal. So stimulating our senses. Again, this is something that I talked about in our last presentation, where we talked about, I think especially for this one, I talked about mindfulness with our senses. And I gave some examples of how you can use your senses to really kind of activate that. So smelling essential oils. And again, these are things that, be adaptive, because obviously some of these things we can't necessarily use in the classroom, like essential oils or whatnot. But this could be, when I talked about grounding techniques last time, this could be as simple as going outside and using those grounding techniques to smell like a piece of grass or something that's a little bit more accessible. Or smelling, if it's, if there's something, chewing crunchy foods, again, kind of that sensory need, movement, jumping on a trampoline or just jumping, gently sitting or bouncing on a therapy ball. Again, it could just be that rocking motion. That could be something that we can teach, or again, weighted blanket, finger painting, any of those things. I think the main thing to take away from this, again, this is about reconnecting your body and using our senses. And so that's going to help us get out of that state of being disconnected. We're asking to bring ourselves back into our bodies, right? So what are the ways that we can increase our fitness and increase our tolerance, our window of tolerance? So rather than it narrowing, the really nice thing is that we can also help widen that window so that we're able to tolerate more, we're able to function better. And how do we teach this to our kids? So what I have here is a list of some things that can be helpful. So teach our kids to check in and to note emotions. You can see that little image on the side, and it says check-in Monday, and it's got the little stickies on it. I found this on social media. I thought this was really great. This was from a teacher, and that she uses it in her classroom. And what she has is she has each kid in her class put their name on the back of a sticky and put it on, where they feel they are at that day. So I'm great, I'm okay, I'm meh, whichever it is, what, relative to like your age group. And what she does is at the end of the day, she'll look at it and she'll check in with the kid and kind of talk about where they were at that, or why they chose that space that they were in. And I thought that was a great way of being able to check in with our students and check in and kind of see, what are some things that we can do if you're not feeling so great, or what were some things, are you still in that state, or do you feel like you've moved out of it? But a really quick way to incorporate that community and that check-in system into the classroom. I also have building up coping skills checklist. Again, that's something that I talked about in the past with coming up with a coping checklist, and that could be something we can work on with students, where it could be as simple as putting it on your desk and pointing out, here are things that are helpful for me that I can use, going for a walk or deep breathing or whatever it is. Incorporating mindfulness, so being present to the here and the now, encouraging students to notice how they feel, what emotions feel like in their bodies, and how they can help calm themselves. This is something that I often do in just therapy, is really with each emotion that kind of comes up, whether it's anxiety or fear or whatever, I typically will ask students, where do you feel that? So that they can get an idea of like these kind of indicators of like, okay, when I'm feeling this particular, butterflies in my stomach, or I'm feeling this particular thing, my heart rate kind of, races or whatever it is, or increases, we can work on strategies to really address that. The language of emotions, grounding techniques, deep breathing, any of those things, recognizing limited beliefs and being able to counter that with positive statements. This is something that I actually heard today, that it sounds, a colleague of mine was saying that they have like a basket or something like that, where they have kind of these positive affirmations, and you can take one if you need one, or you can drop one off if that's something that you wanted to do. But just having those things available to really even looking at, as part of the check-in at the end of the day, of even asking the question, what's something that went well for you today, or what's something that you really enjoyed about yourself today, or something that you were really successful at. But bringing out those positive moments and recognizing them, and having our students be able to recognize them. Teachers can also help, and staff can also help in identifying and labeling emotions, which is really important. So if they see a student looking upset, it could be as simple as, it looks like you're feeling really upset right now. Why don't we go take a break? And in that moment, what we're demonstrating is that not only are we naming an emotion, but we're demonstrating understanding, we're demonstrating validation, and we're creating a safe place for kids. So going back and thinking about how do we build that community, this is a way we do that, is that we connect with our kids by recognizing them, and helping them understand like what's going on for them. The goal here is to widen that window and to build up the capacity to regulate our emotions. And I think that's so important right now. We've asked a lot of ourselves, we've asked a lot of our kids. And I think that in that same sense, we have that connecting, like empathy, that in a sense, we can help each other, right? We can work on this together. We can demonstrate that we have these strengths and this resiliency and this ability to function. And we can also give each other grace that this has been a very, very, very difficult year, with so many changing demands. And even if we are in a space where that window for us has narrowed, we can also help to build ourselves back up. So, the goal again is to give back control, to create a safe space, and to empower. Lastly, I want to take a moment to really thank everyone for allowing me to have a space to talk about mental health. This has been a challenge of mine because I find public speaking kind of uncomfortable, but I'm honored, and I find this to be a privilege that I'm able to take this moment to really advocate and talk about mental health. So thank you, everyone.